From the KDLM studios, it's time for Hodgepodge, presented by Partnership for Health and airing on Lakes TV3.
Good morning, 8:36 here on a KDLM Tuesday, the September 22nd. I'm Joel Kutke. Today on Hodgepodge, we welcome in via our Zoom studios. Heather Larson joins us this morning, a grief specialist with Hospice of the Red River Valley. Heather, good morning. Thanks for being a guest with us today on Hodgepodge.
Thanks for having me.
No, we are glad to have you. Heather, let's talk a little bit before we start talking about grief during a pandemic. Maybe explain a little bit to people exactly what a grief specialist does with the Red River Valley Hospice.
Sure. My role is to follow up with our families after they've had the death of a loved one and provide support and resources to them. That looks different, kind of based on what our families need individually and what they prefer. It comes in forms of in-person visits. Of course, with the pandemic, we've been doing a lot of virtual visits, been doing outdoor visits this summer when the weather's nice and cooperates. We also provide support groups, and those have been virtually throughout the summer now as well. We have a great resource library in our office in Detroit Lakes with a variety of grief resources for adults and children. And sometimes we have families that we work with that are out of town or out of state, and so our support may come in the form of phone calls or virtual visits again, like I referenced earlier. And the great thing about our service is we also provide that support out to the community at large as well. And so I have a number of community clients I work with that didn't necessarily have a loved one die on hospice services, but did lose a loved one recently and reached out looking for that support.
Heather, I think when we talk about grief, everybody assumes it's a loss of a loved one, which it certainly is. But there are a lot of other things besides the loss of a loved one that can present grief and trouble for people that you can help with.
Absolutely, and I think we've seen that more this summer than ever with the COVID-19 pandemic. There's a lot of loss and grief that comes along with that, and so we've been talking a lot about that. Definitely, are aware of that and trying to support people throughout that process as well.
When we talk about the loss of sense of community and a loss of feeling, could be a job or home or even security, I think sometimes, I'm going to use myself as an example, it's tough to reach out for help sometimes. Even though you may feel it down inside, sometimes it's hard to make that phone call or send an email to reach out to somebody.
Absolutely. We always say it takes more strength to reach out than to not reach out. And sometimes we may feel that we're weak when we need or want to do that, but really it really does take a lot of strength. And my belief is everybody is deserving of that support and the resources that are available. It's really something that you have a right to. And I think that just making that phone call or reaching out and talking with somebody might ease that for people a lot. There's no commitment in just making a phone call and visiting and finding out about the services and then deciding from there whether you want to proceed or not. So
during this pandemic, have you seen an increase in what we would consider people reaching out for help with grief during this pandemic because they maybe can't go to a funeral or they're tired of the social distancing thing?
Absolutely. We have seen a significant increase, and I think it's all to do with what you just referenced, and also people have been home more. They haven't been able to get out and do things that they normally do, and so that allows them to maybe have more time or take the time to reach out. And so we have seen a definite increase in that, and just how it affects the grieving process too, with the lack of support sometimes, a lack of rituals, funeral services. So it's been quite busy.
We talk about people coping during a pandemic. Everybody kind of has their own way to cope, but certainly there are some positive ways to cope with your grief, and then there's some negative ways to cope with your grief as well.
Yeah, that's right. And again, sometimes, the not so great ways are a little bit easier than the good and healthy ways, but that's part of what we do with our services and resources too, is to talk about those positive ways of coping. What resources, do people have access to that, they're maybe not using, and just the importance of taking good care of oneself during the grieving process.
Heather, let's talk about some of the resources that the Hospice of the Red River Valley provides for people.
Yes, are you referencing hospice care in general?
Sure.
Okay. Yep. We are a not-for-profit organization, meaning we serve the community at large, regardless of their ability to pay or not. We provide comfort and dignity at the end of one's life. And one myth I think that's out there that we really worked hard at dispelling is that hospice care is for just the final days. And really, we like to see and get in there earlier. We can be involved up to 6 months prior to the expected death of a patient of ours, and that allows our staff to establish those relationships, allows our patients and families to be comfortable with us, and to let us know what their goals are and what's important to them, and we can really come in and help them live out their final days to the best of their abilities and enjoy life.
We're going to take a break here at Hodge Podge. When we come back, we're going to talk about some classes available that are online and in person to help you figure out how you might be able to get through some of this grief during this pandemic. Stick around. Back with more on Hodge Podge right after these.